Hi, so if any of you don't know already, this is my second home. This is the clinic in London, Balance Osteopathy. So I thought today what I'd do is take a little opportunity to talk about KINESIOTAPE. That's the sports tape that you see, you'll see lots of athletes with it, you'll see lots of marathon runners with it. And I wanted to quickly talk about what exactly it is, what I use it for, and how it works. Tape. We use rock tape here in the clinic. I've tried quite a few different brands over the years, and this is definitely always the one that I come back to. We also do like a sensitive range, and they do a range that works like well in the water, so it doesn't just kind of lift off straight away if you go swimming or if you're like running an endurance race, that kind of thing. So how does it work? When we apply it under some tension, it creates space between the layers of skin, fascia, muscles, that kind of thing. Not much, but just enough to allow for better movement of fluid. So you can Google some really cool images, or I think they're cool anyway, of KINESIOTAPE on bruises. And often the way we tape bruises, it's kind of like almost like spider-like kind of legs, or like octopus legs. And that covers over a bruise, like to try and cover a mass area. And then a few days later, when they peel it off, everywhere where the tape has been is no longer bruised, but everywhere around it still has a bruise. So that is a really nice visual example of how tape helps. The main way that it probably helps, or I think certainly the most effective use for it, is that it sort of plays with your nervous system a little bit. So in much the same way, the example I always give to patients is if you hurt your arm or something, and then you sort of do this, rub it better. Obviously we're not rubbing it better, but when we do this sensation, we do feel a little bit less pain being transmitted. And these sensations, they fight basically. They fight for your attention, or for kind of transmission up to your brain to then register as, do I feel pain or do I feel that sort of low level sensation? And that's what this stuff does. It plays with that. So even though you won't be aware of it after a few minutes, what it does is every time you introduce a movement, it pulls a little bit on the skin, hair follicles, that kind of thing. And it just, you're more aware of there being something slightly there versus that sort of pain, and then we have this overprotective spasm and we don't move very well. And the main thing is that when we move more normally, that helps pain get a lot better, a lot quicker, because we're not guarding it, and we're sending signals to our nervous system that actually it's okay for us to move. We don't have to have this alarm system firing. And that is, I think, the most beneficial use for it, really. So let's talk about how to apply it and what you can use it for. So one of the more typical things you might see it on, or a good example of something that's very useful for, is when you have sort of anterior knee pain. So what I'm going to do is just show you a quick taping technique for that over my trousers, and hopefully it sticks nicely. So first of all, I would just take like the first little section of it with no tension at all. So try and avoid touching the tape. And basically that first bit is just an anchor point. So I said it was put on the backing paper under a little bit of tension. If you peel it off and sort of let it go a bit, then the tension's gone. So let's put that down in an area which we're not trying to affect too much by the tape, so I'm just going to go just above the knee. And then we want to use that tension that's on the tape, okay? So we're going to slowly pull away the backing paper, and then we're going to run the finger along. So I'm going to go around the side of the knee, and then I'm going to go around the bottom here, like this. And then that last little bit is going to have no tension on it at all. And then we just go like that, and then that's round and down like this. So the mistake people often make when they're applying this kind of thing is that they put way too much stretch on it. And then it just comes off really easily as soon as you sort of really move that muscle and get things happening again. So what you want to do is have whatever area you're working on under a little bit of stretch. So if I was working on, say, somebody's quad, I don't tape a quad that often, but if I was going to, I'd want it under like full stretch, and then I'd put very little tension on the actual tape, and that's what we're doing here. So same again, little anchor point. Try not to do the start and finish on exactly the same point. You want, like, I've just crossed them over a little bit here. And then the rest of it we'll just do finger along, and I'm just going to go around the kneecap there. Round, 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 get to the bottom, and then like no tension on that last bit, and then like that. Okay, so what would I not use tape for? It shouldn't be used as a substitute for good rehab, maybe advice to change your technique a little bit, whether that's running or swimming or whatever. Those kinds of things, it's not an instead of, but it should be to supplement and assist like that sensitivity and try to move through things more comfortably. It's not fixing the problem, but it is reducing your sensitivity a little bit. The next thing that I wouldn't use it for is if you're using things like, often people on the lead up to something, there's a lot of anxiety, you're worried that things might go wrong, maybe some things that have been niggling during your training, and then you get to sort of D-Day and you think it might be the best thing to just tape everything, just in case. Or your recent training of anything has been relatively pain-free. You don't need to basically patch yourself up for no reason on a race day or on a competition day. It's not really needed. That's probably not having as much of an effect physically, much more of an effect up here in terms of anxiety and that kind of thing. Situations where it's super useful, like I say, reducing sensitivity and helping people move more normally. For me, one of the most common applications I use it for in clinic is with my patients with acute lower back pain. It helps them move more normally, and it helps them to not sort of tense everything, hold on to everything. And that's what I really, really rate it for. If you have any questions or you want to know, have any videos on how to tape anything else, let me know, and I will do some videos coming up soon.